is Jackie. I wanted to talk to you today about chemotherapy and what to expect as you begin this journey. So I know that it can feel very overwhelming, and I'm going to try my best to keep it simple, but please feel free to stop me at any time and ask any questions. So as you may know, chemotherapy is a strong treatment, and it works by attacking those fast-growing cells like those cancer cells in your body, but with that, it may also affect those healthy cells as well. So that's why you may experience certain side effects, and I would like to go over those with you today so nothing catches you off guard. So let's start with something called tumor lysis syndrome. So this happens when that chemo kills those cancer cells very quickly, and those cancer cells break apart and release substances into your blood. And that substance can mess with your kidneys, heart, and even cause muscle cramps. So to prevent that, we'll make sure you're drinking plenty of fluids and may give you medications to help flush everything out. Does that sound okay? Okay, perfect. So another thing we watch closely for is something called myelosuppression. So that's when your bone marrow starts to slow down and it doesn't make as many blood cells as it usually does. So you may have a low white blood cell count, which makes you more prone to getting infection. You may also have a low red blood cell count, which may leave you feeling more tired and short of breath, or a low platelet count, which means you could bruise or bleed more easily. So we're going to go ahead and monitor that by checking your blood work regularly and watching out for signs of infection or bleeding. Now, if you notice a fever, any new bruising, or you're just feeling tired and more tired than usual, please let us know right away, okay? Do you have any questions so far? Okay. Now, we are also going to talk about nausea, vomiting, and diarrhea, which are pretty common. We're going to help give you medications to help manage those symptoms before they even start, but if anything feels off at all, please go ahead and let us know. We're here to help you feel comfortable so we can always adjust any meds if needed. Is that something you're worried about at all? Okay, if you're worried ever, just please come to any healthcare provider, come to us, and we'll help you out. And then hair loss is another possible side effect, and I know that can be very emotional. It's okay to feel whatever comes for you, any sadness, frustration, or even surprise, but hair loss happens because the chemo affects those cells that grow rapidly in your hair. But we are here to support you if you need any help. And there's also something called mucositis, which is when the inside of your mouth gets sore. So using a soft toothbrush and avoiding spicy or acidic foods can really help, but we'll also give you mouth rinses if you need them. And then lastly, chemo can sometimes affect fertility, and if that's something that's important to you, we can connect you with someone to talk about, like freezing eggs or sperm before the treatment even begins. How are you feeling about that part of it? Okay, so we can go ahead and connect you with somebody. And then the most important thing is to keep communication open. You don't have to go through this alone. We are all here for you. We'll be checking in often, and you can always reach out if something feels off. Even the smallest changes can mean a lot. So please always reach out to us. Do you have any questions for me? Okay, thank you for letting me come in today.